Hello student, welcome to my channel. Today I will discuss about GNM third year subject obstetrics important question. Obstetric important question chapter number 3. First one is placenta definition, placenta structure and placenta function. Next chapter number 4 definition of fetal circulation and changes in fetal circulation at birth. Next chapter 5 psychological changes during pregnancy. Next, chapter number 10 definition of antenatal advice. Second, minor element in pregnancy. Next, chapter number 13 first, definition of labor. Next, true labor pain definition, characteristics, clinical features. Next, definition of false labor pain, characteristics and clinical features. Fourth, event in first, second and third stage of labor. Next, mechanism of normal level. 6 number, management of first, second and third stage of labor. Next, chapter 14 definition of puerperium. Second, antenatal changes during puerperium. Third, general physiological changes during puerperium. Definition of lochia, definition of lactation, physiology of lactation, management of normal puerperium, management of elements. Next, postnatal care definition, postnatal care aim and object. Next, chapter number 16 definition of abortion, type or classification of abortion, etiology of abortion. Short question number chapter 16. First, threatened abortion. Second, septic abortion. Third, cervical incompetence. Next, MTP. Long question chapter number 16. Definition of ectopic pregnancy, cause, clinical features of ectopic pregnancy, diagnosis of ectopic pregnancy and management of ectopic pregnancy. Next, heredity from mole definition, causes, clinical features, diagnosis, complication and management. Next, chapter number 17 definition of multiple pregnancy, definition of twins pregnancy, type of twins pregnancy, causes of twin pregnancy and diagnosis of twins pregnancy. Last, complication of twins pregnancy. Next, antenatal management of twins pregnancy. Fourth number question, definition of polyhydramnios, type of polyhydramnios, cause, clinical features of polyhydramnios, signs symptoms of polyhydramnios, investigation, complication and management. Next, oligohydramnios definition, causes, signs symptoms of oligohydramnios, complication and treatment. Next, chapter number 18. Number 1, definition of pre-eclampsia, clinical features of pre-eclampsia, investigation, complication, prevention, measurement of pre-eclampsia and management of pre-eclampsia. Next, definition of gastrointestinal hypertension and its clinical type. Next, explain the HELP syndrome. This is the short type question. Next, definition of eclampsia, causes of eclampsia. Next, causes of convulsion, causes of onset of fits, clinical features, complication onset and management of pre-eclampsia. Next, chapter number 18 definition of APH. APH full form is antepartum hemorrhage, causes of antepartum hemorrhage, management, treatment of antepartum hemorrhage, signs symptoms of hemorrhage, diagnosis of antepartum hemorrhage. Next, definition of placenta previa, etiology of placenta previa, type, signs symptoms of placenta previa, complication and investigation of placenta previa. Short note is that is abruptio placenta. Next, chapter number 20, definition of anemia, classification of anemia, causes of anemia, signs symptoms of anemia, complication, treatment and management of anemia. Next, chapter number 22, definition of preterm labor, etiology of preterm labor, diagnosis of preterm labor, management of preterm labor and prevention of preterm labor. Next, pre-labor rupture of membrane, definition, causes, diagnosis of premature labor membrane. Next, clinical features, complication and management of pre-labor rupture of the membrane. Next, number 3, definition of IUFD. IUFD full form is intrauterine fetal death, causes of IUFD, signs, symptoms, diagnosis of intrauterine fetal death, investigation, complication and management of intrauterine fetal death. Next, chapter number 24, definition of number 1, chapter 24, definition of contracted pelvis, causes, diagnosis, effect contracted pelvis on pregnancy and labor, management. Short note is trial labor and second, disproportion. Next, chapter number 27, definition of prolonged labor, causes of prolonged labor, diagnosis of prolonged labor, complication, treatment and management of prolonged labor. Next, obstructed labor definition, causes, effect on mother and fetus, treatment. Next, definition of macrosomia, risk factor, diagnosis and management of macrosomia. Next, chapter 28. First question, definition of postpartum hemorrhage, causes of postpartum hemorrhage, signs, symptoms of postpartum hemorrhage, type, prevention and management of postpartum hemorrhage. Next, chapter number 30, definition of puerperial pyrexia, definition of sepsis, clinical features of sepsis, investigation of sepsis and treatment of sepsis. Next, chapter number 31, physical features of the newborn, immediate care of newborn baby, breastfeeding definition, advantage of breastfeeding and techniques of breastfeeding. Next, chapter number 32, definition of preterm baby and its characteristics. Next question, definition of LBW. LBW full form is low birth weight baby, type of LBW, management of low birth weight baby and diagnosis of LBW. And short question is fetal growth restriction. Next, chapter number 33, perinatal asphyxia definition, causes of perinatal asphyxia, clinical features of perinatal asphyxia and management also. Next, explain the meconium aspiration syndrome, that's called MAS. Third question, definition of neonatal jaundice, type of neonatal jaundice, causes, diagnosis and management of neonatal jaundice. Next, chapter number 34, that's drugs. First one is oxytocin, second MOSO4, third Ondem, fourth transmic acid, 5 methotrexate, 6 misoprostol, 7th labetalol, 8 vitamin K, 9th carbospostol. Next, chapter number 36, definition of family planning, various method of family planning. Short note is intrauterine copper device, that's the short form IUCD. Next, chapter number 37, definition of hysterectomy, indication and complication of hysterectomy. Next, definition of episiotomy, objective of episiotomy, indication, type and steps. Next, definition of caesarean delivery, indication of caesarean delivery and its type. Short note, post-operative care, first 24 hours up to discharge time. Last chapter, that is 39th number chapter. First question is definition of high risk pregnancy, complication of high risk pregnancy and management of high risk pregnancy. Second, enlist the contributing factor of high risk pregnancy. This is the total important questions of the third year GNM subject obstetrics. If my content is gave you any kind of help, please subscribe my channel. Thank you.